And please find the packet. There are 3 small packets in there. I only want you to pull out one and leave the other 2 in. The one I want you to pull out is the SCS packet. SCS. And for this portion, I know it's warm.
I must try to find this.
If you find a fan, we might have trouble with sounds.
Oh, right.
Okay, so you will only be opening the first page. Please open to the first page only, and you will see that on the screen in front of you as well. That's what you'll be seeing. Individually, so it's not time to share opinions yet, just on your own, not with your neighbor, we would like you, and I'll read it aloud, to read the description of this drug treatment program, and at the bottom, rate your impression of it. So 0% would be that you completely reject it, you know, you're not favorable at all, to 100% you are absolutely in favor of it, favorability. And you can write in a number. We're happy if you want to write 54% or 12%, that is fine, okay? Or you can put a little X along the continuum. All right, safe consumption site. Every community wants to feel safe. Safe consumption sites get drug use off the street because no child should be exposed to hazardous materials while playing in the park. The facility, run by medical professionals, actively stops the spread of HIV and hepatitis C in a community through harm reduction strategies. These strategies have been shown to bring more people into the addiction recovery process than ever before. Safe consumption sites target crimes of desperation at their root to bring a safer, cleaner community to you. Go ahead and rate. And if you're finished with the first page, now you may flip to the next page, and you will see a little bit more information about this program as well as an image. And we want you to rate your impression of this. So each page is going to have an impression rating at the bottom. There are 3 more pages, and you may look at each one on your own now. This is the first, then there's a second, and then there's a third. They all go with the safe consumption site.
Jennifer,
Yes?
who is the target audience to use these sites? Is this prescribed by the court, or is this
So-
open to anyone who wants to walk in?
Let me make sure. You're Pete, right? I'm sorry, I couldn't
Pete,
see your name
yes.
tag. Okay.
Oh, I'm sorry.
It's okay, Pete.
Oh,
I
I
will get
lost it.
No problem, I'll get it. So Pete, let me wait till everyone has rated, and then I might be able to answer a few questions.
All right.
So just going with your impression of this information and this image. What do you think about it? Very favorable,
Oh, thank you.
very unfavorable? Okay, so has everyone had a chance to rate all of the pages? And you'll notice on the very back page, it's just the name alone. And again, we're asking for your impression of that. You may not know much yet, as Pete was indicating. All right, so let's open this for discussion. You can keep your SCS packet out in front. If you need to refer to anything, feel free. Just don't mix with anyone else. Try to keep yours with your number so we don't mix that up. Questions, or mostly comments. Let's open it up to anyone who has things to say.
I have a question about one of the sentences on the very first one. It says, these strategies have been shown to bring more people into the addiction recovery process than ever before. Where does that statement come from, and who is this? Where is this statistic coming
Yeah,
from?
good question. Kaya, I'm gonna throw that to you.
Okay, so all the statements that are in this are from research that has been, academic research that has been done in other countries. So one of the packs, I won't talk about it now, but one of the packs gets more into the actual numbers and statistics, and with also the names of the researchers who found these things. So we're not trying to bamboozle you.
Yeah, everything you have is from a scholarly published journal article, and generally many. So we combed the research on this topic and found, we think, almost every article that's ever been published, and then we summarized that for you here.
Okay.
And so these would be scholarly, peer-reviewed, other experts in the field before the research gets published.
All right, thank you.
You're welcome.
I think it makes sense. I mean,
And speak up a little
okay,
more.
I think it makes sense. I mean, I drug use in the community is going to be a problem, but I mean, for somebody who loves an addict, you know, knowing that they could be somewhere and do it in a safer way matters. And then for somebody who maybe isn't involved at all, but just a community member, I feel like they could feel safer too. So, and I do like that sentence that you asked about. You know, it is. I like that it's research based, because I could see where if you're bringing people into a place that's reinforcing for them to go there because there's something that is highly, you know, reinforcing for them to get, then maybe you can help them because you could get them there.
Yeah, I saw Jenny's hand and then Sylvia.
2 questions. How would it be paid for, and where would the site be located if it were in this community?
What would you guys like to see or not see? Because we don't necessarily have the answers. It's all in the like maybe and planning stages, maybe. Let me ask Sylvia, and then you guys think a little bit about what would you like to see? How would you want it paid for, and where would you want it if it were here? Sylvia?
I want your definition of addiction recovery process. What are we referring to?
Say more, Sylvia. What's your thought about that?
Well, it says this strategies have been shown to bring more people into the addiction recovery process. I'm not quite sure
It's a
what.
little vague.
Yeah, what you're talking about.
I just took that to mean that they somehow, there's so many different addiction recovery processes, so I guess I just took it to mean they got involved in something, whether it was an inpatient rehab or counseling or something.
12-step or...
Yeah.
Kaya, do you have a recollection of that specific study, what the recovery processes were that they were referring to?
So they were talking about detoxification and going through the process of getting the drug all the way out of your body, and in a lot of the places they had a counselor there that was also like helping you process your addiction and get through it.
So would it be something like Tucasa that we have now in the community?
Maybe you could explain a little more about Tucasa for people who don't know.
Okay, Tucasa is a substance abuse recovery program that they're having trouble getting it to be 24/7 because of licensure. They can't get therapists or nurses to work
In the nighttime.
in the nighttime graveyard. And so, but they do have a beautiful building. I don't know how many of you have ever been there, but it's a gorgeous building, big building, very modern. And so right now they're just doing mostly counseling.
But this is actually using the drug. I know that they do drug-assisted recovery, but that's not the same as actually being motivated to go somewhere because you know you can get the drug you're addicted to.
Let's break that down a little, Chris. So some people might not know what MAT is, which is medication-assisted therapy or treatment. Can you explain that?
So I know there's different types of medications such as methadone. People usually hear about methadone clinics and
Suboxone.
yeah.
or others.
So it's a drug that can help you, that can help ease the craving for the drug. It's not the actual drug, so it's not actually heroin, but it can ease the craving for heroin. So this would, I mean, the way I'm reading it anyways, you actually could go there and do heroin in a safe way with clean needles, and I'm just using heroin. I'm in a nurse clinic,
See, and I took it differently. I took it as
yeah.
kind of like an inpatient facility.
I'm just reading it as a place you go to safely do drugs.
So
I'm
instead of,
not reading that because of recovery. I mean, recovery means, what does recovery mean? I mean, doesn't it mean you're recovered from this addiction?
It's just saying it can be a gateway into maybe somebody might be get interested in recovery.
Into recovery?
Yeah.
And wasn't there something, for those of you who've been around a while, didn't we have something at Fort Baird?
Absolutely.
Yucca Lodge.
And what
Absolutely.
happened there?
They moved it to Roswell. One of the problems was they were coming up with Sukasa, thinking that they were going to move it from Fort Baird to Sukasa, and the Department of Health, under one of the administrations, decided to move it to Roswell. It's in Roswell now.
It seemed like there was a pretty long period of time
It-
between Fort Baird and Tukasa.
There was,
Maybe
because
2
it took a
years?
while. I mean,
Yeah. Okay.
it's
It
like
took a
all
long
government funding. One of the problems I have right up front is talking about drug addiction. I mean, to me, the biggest drug abuse in any community is alcohol. So I mean, when I had to put my head around it and go, okay, they're not talking about alcohol, which is the most abused drug we have in society.
we already have supervised consumption sites
That's
for
it.
alcohol.
It's like- I mean, it's really, that's why I had to put my head around it and go to the European models and some of the models in some of the other larger cities where they have done this, and it hasn't. I can see a heroin addict going there and doing that. I can't see a meth addict doing it. So I think.
How come? Can you say
Well,
more?
because most meth addicts are too hyped to be anywhere except in a controlled, like their house.
Sitting
They
in
don't-
a doctor's office while high on stimulants doesn't sound as doable as sitting in a doctor's office while high on an opiate.
That's it.
Interesting.
I mean, it's exactly correct. So, I mean, there's a lot of dynamics when you start talking about addictions that need to be addressed and thought about. So I think everybody's thinking one thing. Let's say a methadone pill. Let's say, you can go get needles and do that in a controlled situation.
And let me clarify momentarily that this site, at least the way it's proposed, would not provide what do we call it, MAT,
Right.
like Suboxone or methadone. It could, that would be like the community's decision if they go that route. It would be the person walking in with their own drugs.
Oh, with their own drugs? Would they have drug checking programs as well to screen for fentanyl or other adulterants?
That's a really good question. Why do you want to bring that up?
Well, because if someone's walking in with their own drugs, drugs from a drug dealer could kind of be not exactly what they're sold as. Whereas if you go to a supervised consumption site that provides the drugs for you, they're drugs made in a government lab.
Yeah.
You know the dosing,
I
you
see.
know.
Harm reduction, yeah.
Okay, let me get to Sammy and then we'll see if we can come around to something of an answer there. Yes.
So the way I'm interpreting this is this would be a community-funded area, correct?
Yeah. Yes.
Okay, so there's a lot of legalities that you have to think about with this, because if people are bringing their own drugs from like the street, that could pose as a liability. So why would a community want to fund this whenever there are doctors that provide Suboxone? The doctor I work for, he has one of those specialties.
And why would
So
people
why
go?
can't we just rely on that? That's proven to be, safe, beneficial, and the patients do recover.
Interesting.
Are you talking about Dr. Bowen?
I just don't know how you get people to
I work at the
go if they have to bring their own drugs. I mean, access to needles. I don't know what would.
Some involve clean needle exchange. Some of these
Yeah, so I don't know
programs, not all.
what would bring them there, what the reinforcing factor would be if they're not getting. To me, I read it as they would be provided with the drugs. That's what would get them there. So if they're not, I don't think you get near
I kind of
the
feel the
turnout.
same too, because like if you're looking at reducing crime by getting these people into a location where they can get the drugs, then they're not breaking into houses or stealing other people's things to go and buy the drug. So
Or
that they
hurting
can go
themselves
to the
by
home.
ODing on fentanyl. And
Right.
Yeah. I mean, it's
And
that
definitely
changes
there would
everything.
be, okay, so definitely there would be someone there, let's see where it says, run by medical professionals. It doesn't exactly say, but if they OD'd, they would be brought back. There would be
Right.
Narcan and the available staff to bring them back.
But what would make people want to go there with their own
Yeah, how
drugs? Like,
safe are they gonna feel going there?
I don't know. Yes.
So what you're kind of saying is, I'm an addicted individual, and me and my buddies, we want to go shoot up somewhere, so you're trying to get us to want to go to this place. Instead of
Rather than the park.
instead of doing it wherever
Right,
we
the
want to do
streets or
it.
the park or maybe someone's home.
Yeah.
but
Mhm.
without
And-
providing the
Or a
drugs.
car.
And
Or a
I
car.
mean, I think you're asking individuals that are probably not clearly thinking to do something that is safe for everyone else where they're not even in that mindset.
Okay.
To me, that's
So you're
what
saying
I'm
you don't think
thinking.
they would see it as a safer alternative, like someone monitoring them and checking on them?
Why would they
while
care
they're
about,
using?
Not an addict,
Okay.
yeah.
yeah, why would they care about
Huh.
making it safe for other people? You know, they're just
Or even
fixed
safer for
on,
themselves.
yeah,
Right.
they're just fixed on doing what they want to do. As far as Narcan, you can go to any pharmacy and get Narcan, any person can. You can ask for that.
It's
and
pretty
say-
expensive.
And well, I mean, you know, but
It's
but you can get it and it's available to, if you have a loved one that's an addict, you can request that and get a prescription. Well, actually, the pharmacist can write a prescription and you can buy Narcan, so.
Mhm.
They have a standing order too from
Yes.
like,
Yeah,
yeah, that you can print to bring
yeah,
in.
so Narcan is not a
Not
reason.
gonna get them there, yeah.
So are we talking about one of these pages at a time, or are we talking about the whole
No,
packet?
you can open this whole packet is an SCS packet and you can refer to
Yeah.
anything or ask anything or talk about anything in
Because
there.
I'm looking at this picture and I never see this happening.
Mm. Say again, say what you mean.
I see this picture right here, and I
She's
don't,
referring, by the way, recording to the little girl's
Yes.
legs in the park.
yes.
Mhm.
I mean, the only way this is ever gonna happen is if every addict and everybody using needles is going to not go to a park and shoot up or leave it somewhere. And,
Are you saying it only takes one?
yeah, it only takes one.
Yeah,
Yeah,
going through this was struck by, it just seems so idealistic.
It is.
Mhm.
You know, it doesn't seem real to me. I've been in recovery for 34 years, so, you know, having worked with many people and going through what I did myself, you know, and I saw this, you know, the police, they stopped the supply. Well, how did they stop the supply? You know, they haven't been able to do that yet, and over so many years, and then SCS stops the demand. Yeah.
That
I
one
mean,
is
it
a
just,
little
it
nonsense.
seems
Yeah.
like just totally unrealistic.
So you'd want to know maybe if,
Yeah, if it's bring your own drugs and there's no supply.
so if the SCS, maybe if I can paraphrase a little and then I'll get to you, Sylvia. If I can paraphrase a little, you're wondering, does the SCS slow down drug use in the community simply by providing a safe space for people to use and be prevented from overdose and or a door to recovery?
Yeah,
down
I'd
the
feel
hall?
better if it was more like, you know, they can make an impact
Okay,
instead of,
not such a bold statement.
you know,
Okay,
she can walk through the park
Paradise.
barefoot, you know, 'cause there's, you know,
Okay.
everybody
1 minute.
that's shooting whatever is now doing it in a safe haven, we'll call it.
yeah.
You know,
Okay,
I don't see
Sylvia,
that
and I think
happening.
we'll make this our last comment on this segment, but these all build, and I'll check in with a couple people I haven't heard from yet in the next segment. Sylvia?
Okay, being a substance abuse counselor for 30 years, I've seen a little bit of everything.
Yeah.
But we had a party at the Penny Park for one of our grandchildren, and sure enough, we found a couple of needles way in the back, you know, parking, and so I don't know how safe it is to walk in the park nowadays.
Good point. Okay, all right. Then what we're going to do next is you are going to pull out your SIF packet and you're going to put away your SCS packet. And she'll show you that on the screen in case you get confused. SIF packet. SCS goes away. And I will go ahead and read this, but again, just flip to the first page only, and that's what you will be rating your impression of. To remind you that if you fully, completely reject it, you would probably circle 0% or write in a very small number. If you are in full, complete support of it, or favorability, I should say, you favor it, you can do all the way up to 100%. Supervised injection facilities. In 2019, 49,860 people died of opioid-related deaths in the U.S. Luckily, addiction science indicates supervised injection facilities give people a non-stigmatizing environment in which they can begin recovery at their own pace. SIFs not only save lives, but effectively help stop the spread of HIV. The facility provides a hygienic area in which people may consume their own drugs with medical supervision. And in one study, in the 500-meter square area around the SIF, overdose mortalities dropped by 35%. There have been 0 fatalities or deaths inside of an SIF worldwide. Additionally, neighborhoods with an SIF see a 30% increase in the use of detoxification services, bringing more people than ever into recovery. Experts agree that supervised injection facilities are the best way to combat the opioid epidemic and the spread of HIV. Go ahead and rate your impression. Ready, you can now flip to, you'll have a little more information and some imagery to go with this packet, and you will rate each page. Okay, you can flip. You're fast. Yeah. Now we can open up the discussion again. And maybe I'll start with someone I hadn't heard from yet. Let's see, Richard, did you want to say a few
Sure,
things?
I find, I can go back to the first page of the other one too. It's basically the same comment.
And maybe speak up just a little more.
I think that a lot of times when we, as researchers, go to find out something, we often find out what we wanted to find out to begin with. And I see there are a few statements here that look, 0 fatalities. I mean, what are the numbers we're talking about here? How many SIFs are there?
142.
Yeah, it seems.
None in the U.S. whatsoever.
No legal ones in the U.S.
That's an incredible number, and I've traveled to a lot of countries that have this stuff, and it's not the utopia that this would seem to indicate. Would I rather have someone in a controlled place if they're going to do that instead of our city parks and some street corners, that kind of thing? Yes. It's just, here's the deal. The stuff that I've seen that works, that I've seen the numbers on, and my numbers are a little old, so I don't want to say them. Anything short of a faith-based initiative with all this other stuff with the numbers are not anything like what's being said here. The ones that are strong faith-based initiatives, their numbers are pretty high for drug rehab and stuff, and I know that's not exactly what we're talking about.
Sure, maybe not.
So that's just what's going through my mind.
Okay,
Incredible
thanks.
numbers.
Okay. I also hadn't heard from, is it?
It's Carol and
Oh, these darn
it's
things
my
are falling
cat.
off. Okay, Carol, thank you.
I think
Yeah.
it was interesting when he said that this is kind of an idealistic thought here. Of course, the first thing I did, I was very interested in what was going on in the first packet. Because I wasn't sure what I was trying to figure out. But on this one, where it says there have been 0 fatalities inside of the SIF worldwide, that's a fact.
It is a fact. No one has overdosed. They've all been saved if they got close to overdosing.
But there's not that many people going to them, these facilities?
I don't know if I have on the top of my head numbers, but it is 30 years worth of data, 142 sites,
Around the world?
potentially dozens to 30, 50, 60 people a day, depending on the size of the site in the city. No overdoses so far, not a one, because there's someone watching and there's medical professionals there.
Really able to medically prevent death from OD if you're waiting for it, you know?
But what countries are we talking about? Are these,
But
Let me ask you why that matters.
You know?
What would matter if you knew which countries they were or weren't?
well, I'm just curious.
Well, some countries have the finances to support this, so that's probably another reason why Ms. Rhonda wants to know.
So maybe money could really matter.
And also, as Americans, we're just free spirits.
Yeah.
And so there's countries, like I just talked to somebody who lives in Germany, and when they say through this COVID thing, this is not going to happen or this is going to happen, that's what
That's
happens.
what happens.
So
yeah.
they are very strict and the people follow. So that's why I'm interested. Americans, we don't tend to all be followers, do we?
I get it. Okay, thank you. And yes, Jenny.
I just wanted to say there's different documentaries out there about these types of facilities in the United States. They're not legal, but
Right.
they happen.
Right.
And they do
We know of
save
one
lives.
underground for sure.
And you do see people nearing overdose that go to these places that talk about how it saved their lives. And some of them have gotten clean. It's not to say the vast majority, but they exist. They're here in America and they do save lives. And there's documentaries about it.
And I guess it just takes some, I guess like with any recovery, it takes some kind of motivation on the individual's part to get there. They're not bringing them in with the drugs. You know what I mean? I guess I'm just kind of processing that because on the first one I'm still stuck on the, I thought they were going to give them drugs when they got there. So I
No.
guess it's just that you've got to be somewhere inside where you're at least slightly interested in some help.
Can I tell you one way they got them there was the safe needle exchange.
Okay.
Because their needles get dull, they can't keep reusing them, it's too hard to go to the pharmacy and get them. They don't have a
Okay.
grandma with diabetes, so they can get their new needles there.
Okay.
So that might be
So-
one way to get people in the door, you're saying, is having a clean needle exchange as well as a supervised
It's not to
injection.
prevent HIV or anything like that, it's because they need a
They need
needle and they
them,
can
yeah.
get it there.
Sure, they're not thinking about the prevention of death
Right.
of HIV. We are, huh?
Mhm.
We're thinking about that as a public health issue.
I do think it is possible to get people who are addicted to substances to care about that, though.
Yeah,
Yeah.
say more.
I think one of the many benefits of these sorts of programs is treating people like they have the capacity to be responsible, and letting them know that they can care about others with their actions. You know, there's a lot of sort of dehumanizing of people who use drugs and people who are addicted to drugs as people who don't care at all. And of course, something about addiction is that it can, you know, make you act in ways that are way outside of your integrity, which is why one of the major steps in 12-step is, you know, figuring out your integrity and making amends for where you've acted out of integrity. But you first have to be told that it's possible for you to have integrity at all, you know, and be treated like you have the capacity to be responsible.
So you gotta get in that door first, right?
Like you matter. Maybe like you matter. Okay, I saw Sammy, I think, and then
I don't think that's a one-size-fits-all situation, though. I've had various patients within the facility that I work at where their parents have to call and make their appointments for them. It's their parents that are in control because they're not in their right mind to make sound decisions on what they can do to better themselves and better the people around them.
They're terrified too.
Yeah.
When you say parents, are these minors you're thinking of?
No,
Yeah.
older people, but
Yeah.
the parents have like total control of, you know, what's going on because they're not in their right minds.
I see.
So that's just something to ponder. It's not a one-size-fits-all situation, and I can guarantee you not everybody would be able to fit into that. The facility. They're not just going to voluntarily go there thinking that they're going to make a better difference for people around them.
But having those parents that call, it's not just control, you know, it's also loving the hell out of their child and trying to do everything they possibly can. It's
But
not,
sometimes they enable
of course.
Yeah.
one or two.
Yeah. Let me,
For
sorry, I
my-
think Lucia was waiting and
Okay.
then Brian,
I
absolutely.
just wanted to make a couple of comments. I think what Sammy and Emma have said are really, really great. coming from the viewpoint of being addicted once myself and knowing many, many people up until I was 49, most of them addicted. It's the general population that we get into a self-serving mindset, a selfish mindset. That doesn't come naturally, that comes, well, it does come naturally. It comes more so when we are using substances that change our value system and our morals, and what we're looking at and what we're focused on and what we need, because many of us know that through addiction, people will do whatever they have to do to get that drug. So, and most of the time you can look at that individual, and as a clean, sober individual as I am today, I would never consider doing some of the things that I did. But I was not in my right mind. I was under the influence, so to speak.
Yeah.
So I want to make that point. And
So it sounds like you guys are talking a bit about the humanity of people who use drugs, and
Well-
somehow communicating that they matter and that there's hope.
they do matter and there is hope, but in my opinion, I've never known anyone that got clean without absolutely desiring it on their own. Nobody I know ever got clean because a parent made them do that or a sibling made them do that. If they did, it was short term and they went back out, so to speak. So I want to make that comment. Also want to make the comment as a retired pharmacist that there are a lot of opioid-related deaths. There's so many ways that people die from opioids.
Yeah.
You know, buying them on the street, selling them. Doctors writing for scripts, getting kickbacks. There's so many ways that opioid deaths happen. So
Not just through injection, is that kind of what you're saying?
yes.
Okay.
And so this,
Let me
you know,
let me check in with Brian because he's been waiting. Did
okay,
you
I have
one
one more thing
last
to say
okay.
because
All right.
also about HIV also. Yes, if you're not using the needle, that would contribute to a healthier statistics as far as HIV and hepatitis C, but there's so many different ways too also to contract those.
Of course, yes.
Okay.
Yeah, good point. Brian,
Yeah, I was just going to say from my experience, a lot of people come in because of the law. Okay, that's one of the things. There's not a lot of people that come in on their own, unless they have hit a horrible bottom and they're at their wits' end.
are you talking about a traditional kind of rehab,
Yeah,
not this kind of program?
I'm talking
Okay.
about anyone surrendering, whether
Yeah.
it's to this place or to a treatment center or to AA or
Faith-based or
yeah,
anything.
whatever, any of the other programs. Generally speaking, people have advocates. Some kids, some adults are fortunate that they're from loving families, and somebody within that family community or friend or girlfriend or husband or wife, kind of push them in. That's what happened to me. I didn't want to, but I was so tired. My fight was gone. So they just shoved me in that direction. And you're right. That didn't work the first time. But I heard things that stuck. Seeds were planted, and those seeds began to grow. And finally, it was something that I wanted.
Yeah.
So, but I look at these things and say, hey, listen, if you can help with the spread of HIV, I look at these programs as, making progress, moving forward, I think a lot of times we look at these things as a group and we're looking obviously for the best possible outcome, but we're looking at it unrealistically.
Okay.
And
Do you feel this
but-
kind of program, and I ask this of everyone too, is a more realistic attempt to get people a foot in the door? And maybe to hear, like you said,
possibly,
some things, or
I just,
consider another way?
my whole concept of it is more holistic,
So are you saying something's missing from this for you?
Well, I look at it from the standpoint of, geez, I don't know. I guess I don't really totally understand exactly what this is. I think, you know, when I first opened up the first book, what hit me right away was confusion. You know, it's like,
Good to know, okay,
gee,
Us too.
okay.
Me too.
you
I
know,
agree with
this seems, and immediately it seems so idealistic. It doesn't seem real without knowing more information.
Okay,
So I guess I'm just very skeptical.
okay, okay, so we're nearing the end of this segment, but I realize like I'd really like to hear from Pete and Matthew. Maybe the next segment we can start with you guys? Or do you have something burning you want to say now?
Well, I like that.
I
We've
just-
been being polite.
Not going through these experiences of addiction, but it seems to me that this is kind of a one-way program, both of these.
Yeah, okay.
They're open-ended, one-way programs. There's no partnership. I think for anything to make sense, there has to be an agreement between the invitee and the user. I don't know if it's a handshake or a signed document or a set of responsibilities that this facility is available, but you also have to do certain things to be able to use the facility.
Okay, what, do you have in mind a couple of things you might recommend?
I don't, but on B, I know the Swiss have a drug intervention program that comes with jobs. In other words, the Swiss will provide, the treatment is free and open and available, but the requirement is that that person also take on the responsibility of a job,
Okay,
which kind of reinforces stability.
interesting. Okay, good point, guys. All right, well, what we're going to do is get our last packet out. So put that one back in, and you shall now get your OPP packet. OPP. Yeah, you know me. I had to. You know it, Aunt Debbie. Okay, so you can open to the first page. We always start there. You'll be rating favorability or unfavorability of this. An overdose prevention program. Many of us have been touched by a life that was tragically lost to an opioid addiction. The worst part of the story is that each one of these lives could have been saved. Almost 50,000 people die annually from opioid overdoses. Overdose prevention services change lives for the better through harm reduction strategies with an aim at full recovery. Services such as medical supervision with professional staff, counseling, and rehabilitation are provided. These services have been proven to reduce the spread of HIV, save lives, and transition people into the recovery paradigm. We don't have to stand for another needless death. Overdose prevention programs save lives. Go ahead and rate. And then when you're ready, you can flip. You'll see there are 3 more images with a little more information. And we also want your impression of each one of these. From very unfavorable to very favorable. Of course, the last page is just the name of the program and kind of rating your impression of that. Okay, so if you're ready.
Can I start again?
Sure, and then I'm getting right to Matthew after you.
how can, A being the first page,
Okay,
and the photos being B, C, and D.
okay.
A has nothing to do with B, C, and D.
Oh,
Um,
tell me
and,
more.
OPP extends lives on average 34 years. OPP saves lives. Could anyone be against lives being saved?
I don't know. What do you guys think?
A lot of people are against the lives of people who use drugs being saved.
Yeah.
Yeah, I've handed out Narcan and people being like, I would want someone who overdosed in my store to just die.
I've never met anyone that wants someone to die.
Really?
Well, I'm glad you have that.
Yeah.
Our last focus group, it was said that maybe we're better off without,
Dead than alive?
and that maybe we're overpopulated anyway.
Oh, my God.
What are your feelings about that?
I don't know if it's because we're overpopulated, but they might think that they're not contributing to society. Maybe I'm not one of them. I'm just
It's okay,
thinking
I've
about
had
what
those thoughts.
they might think
Put
that,
it out
but
there.
maybe they're not really contributing and being negative in
Okay?
society.
Or that it's a consequence, they were,
That
yeah.
every addict has a family,
I was gonna
and
say,
they
Right.
mean something to that family regardless of their addiction.
they have a mama.
Mom, sure.
Their mom.
And
Yeah,
maybe kids, maybe nieces and nephews who look up to them, and so helping them to recover or preventing them from dying could have a major impact on 20, 34 other people.
it's not just the
It's
addict,
not
you're
just the
saving in
addict.
a way, or saving from that horrible grief. Interesting.
And
Okay.
I do agree with this, 70% of addicts started with a prescription. I believe that could be true.
It is,
Because I know that now, when they have family members have surgery, they're very careful. They want them just to do the extra strength Tylenol and, you know, but 20 years ago, you know, my husband had a herniated disc and he went to 3 or 4 doctors and each one gave him a prescription of 500 Vicodin. If he would have filled all of those and started taking them, I mean, he had the access to thousands of Vicodin, which he obviously didn't do because, you know, he was smarter than that. But so I think that the doctors are being more mindful that, yeah, it hurts, but you can get by with some extra Tylenol.
Yeah.
I think it's fear of arrest, fear of losing their license.
Yeah.
Can you say that
But
one more
it's good
time?
because
I
it's
couldn't hear
saving
you.
addiction.
I said I think it's fear of arrest or fear of losing their license, because here in this area, there have been so many doctors who were doing just that.
They're being held more accountable.
Okay, we didn't get to you, Matthew, please.
Okay, and Matthew wants to talk about,
Yeah?
you know, I think this would probably be a wonderful program. I worry about the size of the community we live in.
Same
I
one.
could see this working very well in San Francisco, downtown in the business district. I could see it in New York. I could see it in Detroit. We, as Sylvia was talking about, we have a problem staffing Sukasa. And I really don't know, I don't, you know, obviously we're talking about opioids the whole way because I was talking about addictions as a whole,
Right.
you know, and I believe in many addictions.
And I don't, just to add, I don't think that OPPs necessarily discriminate. So the ones we know of that are running, I think anything that the person brings in is allowed.
So an alcoholic
I think
would be
so.
accepted. See, I don't know, but
I
I could see it working in larger cities because the numbers work for you.
I see.
Okay, in a small community like this, I think it's very difficult to have things staffed.
What kind of staff would need to run a place like this?
Well,
What
one,
do you
you'd
guys
need
think?
an RN and have to have a doctor on call.
Do you guys want to know if that's how other OPPs function? Do they have
I
RNs
don't,
on
being
staff?
foreign countries, I just know that our
Yeah.
rules would dictate
You think so?
that you have to have an RN.
That's if the state funded it, right?
I think it,
It
jump in
has a
here,
lot to do
Sylvia.
with the state.
Yeah, if it's a nonprofit, however, who could staff this, would you guys think? Or who might be
Certified peer
appropriate?
support workers, maybe?
Maybe peer support workers?
At least as a facet of it, maybe
Yeah.
not the entire staff.
Okay,
That'd be scary though,
Former
because when
addicts.
somebody goes into major shock or whatever you wanna call it.
yeah.
Yeah,
Is
that's
there
why they couldn't
somebody-
be the only ones.
Right, is
And
there
for a
they-
somebody that can-
nonprofit, that goes right back to what Sammy told us earlier. the
Liability.
Yeah.
piece.
So it would be the same as in your own home. Someone goes in it, you call 911, right? So they would kind of have that similar thing. If you're the mom, you don't have any training in this, you call.
And
they
if it's an
would
opioid,
possibly-
like say, we were talking about Narcan. My wife just got through with a knee replacement. And when they gave her pills, they also gave her a couple of things in Narcan in case that did happen.
Uh-huh.
So it is available.
Yeah, so of course they'd have that here.
Yeah, they have all of that. You know,
So staffing and money, that we had brought that up way early on.
it's always the deal.
Yeah, okay, and then Kaya, why don't you pose your question about legality, and then let's think a little bit about staffing, legality, money for you guys.
Right, so Sammy got into it a little bit, but I'm curious what you guys think about the legality of it all, how this facility would be a protected place where, you know, a cop couldn't just come and pop these people and bring them to jail because they were abusing there.
Using something
It
illegal.
would be a protected area, and I'm kind of wondering what your guys' thoughts are on that.
Well, that would have to go through your state government.
Yeah.
It would have to be legalized for it to, you know,
Right.
at least be for that facility. But I think that once an individual leaves the premises, then if they are high on drugs, I mean, they know the risk.
Mhm.
That should definitely be within paperwork that's signed because of legality issues, that a cop should be able to arrest them.
So you can be arrested for being high?
If
Yeah.
they are
Public
causing
driving.
disruption in the community,
I'm just
yes.
saying, like, if
Right,
you're.
it'd have to be a crime, huh? It'd have to
Right,
be they're
you'd have to
carrying
commit a
illegal
crime.
substance in the right amount, or
Be
they're
caught
driving
with
a
an
car,
amount.
or, yeah.
The fact that someone uses drugs.
Yeah,
in and
they
of
gotta
itself
stand
is
out.
Well,
not-
I mean, a lot of times they disrupt the peace, so an individual can call from a neighborhood concerned, like this person is yelling, this person is being very suspicious. A cop can look, you know, check out the situation. If they are carrying, then yeah, they can be arrested.
Well, if they're doing something other than just being high. Yes.
Are you worried a little, Sammy, like then would the OPP be held responsible for that person's behavior because they allowed them to use?
Well, I mean, yeah, who's gonna point the finger? Who's
Uh-huh.
gonna, you know, be blamed?
Interesting.
Is that really, excuse me, is that really different than bars and serving alcohol and somebody leaving the bar?
Well, alcohol is legalized in the states.
Right, but these places would be legalized, right? If we were to go in that direction, it would be the same. They left, they would be held responsible. I know that, well, I'm not sure about New Mexico, but I know the state that I came from, there was a time period where the bars, you know, the states were
liable?
fighting, yes, about how liable the bars were, allowing someone to leave under obvious influence of.
So that might be
alcohol,
something we
so-
could look into, and that would be almost a precedent, perhaps.
The bars can be charged here for
Okay.
over serving.
Yes, okay,
Absolutely.
thank you.
Interesting. Okay, so we're talking a little bit about liability, legality. More comments on that? Questions on that? Yes.
What Matt said made a lot of sense because several of my clients, I want to refer them to CASA, to the program, and say, oh no, everybody knows me there. And so they would prefer not to go and just stay without patient counseling, but that's the right thing. A small community, everybody knows everybody.
They want anonymity, but can't.
People
get it.
need to be trained in HIPAA. HIPAA training needs to occur for everyone who's on staff, if
Yeah.
that's the case.
Sure.
Yeah, but
Okay.
what about other clients? Do they
Interesting.
say
That's
about
what the
HIPAA?
clients are the problem.
Yeah,
And lessening the
that's a
stigma
big question.
behind addiction too, which goes back to the dehumanizing and, you know, it's just.
And that's why a lot of people end up going to Las Cruces to get their methadone or Suboxone treatment. Because
Yeah.
they don't want people in the community to
know.
know that they've got that issue.
I think that's a problem with a lot of different mental health
Yeah.
aspects,
yeah.
not just addiction.
No.
Yeah.
But they get paid for going to Las Cruces.
Yeah, there's a definite stigma. You
Yeah.
know, people don't want, especially in the early part of everything. I mean, 34 years, I don't care who knows.
Yeah, but
Because I feel as though I can be helpful to some people. But early sobriety or during my addictive years, I was very secretive. You know, I mean.
Families will be too, for their
That-
family members.
It's embarrassing for
Embarrassing,
families
they feel
sometimes.
guilty, they feel.
Yeah,
And I would be a little concerned, you know, here's this safe haven, but here's this cop who's got it out for this guy, okay? And he's just waiting. He sees him go in there, and he's just waiting for him to come out so he can pop him.
Yeah, there's gotta be protection, because we
You
know it's
know,
not gonna
yeah,
help.
it's like, this has got to be something where the whole community is behind this effort.
Yeah.
Because if they're not, it isn't going to work. Because you're going to have factions of a community that are going to be, you know, just out to get certain people.
Okay.
Because
this-
a lot of
this is
these, you know,
good.
whether it's an alcoholic or a drug addict, I mean, the stuff that we've done causes harm to others, and there's a lot of people that are addicted.
Yeah, they're angered.
You know, and they don't care if you're, oh, he's trying to get straight now, you know.
Yeah. Okay, let's dig a little deeper here with the time we have left on this segment, and based on all I just heard. Let's imagine that the legislature in New Mexico does pass a program, something, an OPP. It was before the legislature this year. It did not make it to the level of everybody seeing it. You know, some bills die before they
Do
get
you know
very
what
far.
bill number it was?
I don't, but I have it at the office, so
Okay.
you can email me.
Okay.
It could go up again next year. So let's imagine that it's now legal in New Mexico to have a program like this. And then it's up to what we understand, it would be up to the municipality, you know, to decide if they'd like to open one. Imagine that. Somebody said earlier, where would we put it in Silver City? How do you feel about that? What would this be like for you as community members? Because you just said if the community doesn't support it, and this is why we're here today, why do it? You know, that doesn't make sense, right? Waste
Do
of
you
time and
even
money.
want it?
Do you want it in your community? And if so, maybe there are things missing. Like, I'd like to hear what would need to be present for you to support it if you were to support it. Big couple questions there.
I support it. I
Okay.
think we need, drug use is happening anyway, so it's not. And I think we need more than we have. So I think we need to try.
Does
But-
it matter to you where it's located, or?
I know. Do I want
Sponsored?
it in my neighbor's house? Yeah. I mean, yeah, no, probably not.
I would like to see it near the hospital.
That's
Okay.
what I was thinking,
Yeah.
medical.
Is that where Tukasa is right now? Kind of up on the hill?
It's
32nd
kind of
Drive.
fine if the Health and Human Services, the Human Services building, if you're the road past Walmart, you take a left and it's on your
Then
right.
Altamirano.
Yes,
Right.
okay, so kind of near the hospital, not completely. Okay, so maybe in
Well,
that zone
but-
there?
You wouldn't want this near Sukasa, because somebody trying to recover doesn't want to be next to somebody firing up in the next door. I
Interesting.
mean, you want to have a separation between those that have hit a bottom and are willing to go to any length versus those guys still using and haven't hit that bottom.
Okay.
And you have to think of it, accessibility. It has to be easily accessible
Yeah.
to most.
To those people that,
Yeah,
See,
they're gonna
that's-
need it.
Yeah.
Hmm.
See, that's where I was,
Probably may not have, you know, transportation.
Okay. Sylvia?
I was just thinking of that program, was it Spin?
Yes.
Look how much trouble they've had putting it in that certain area.
Yeah, there was a town meeting. Maybe people don't know what SPIN is. Can you explain?
I don't know what it stands for, but it's,
Supporting people in need.
there you go, thank you. It's people that are homeless, and especially during winter, they can go and stay there, get a meal and so on. It's a really good program, but man, the
The town turned
neighborhood-
out. The
Well,
neighborhood was not happy about having it in their neighborhood.
it's always that everywhere except my backyard.
Yeah.
It's called
I
NIMBY,
mean,
right?
you can look at a former
Yeah, not in my
mayor
backyard.
that was fighting economic development because it was right down the road from,
Yeah,
you know, anywhere but my backyard. kind of
Yeah.
attitude. And that's the way
it's hard.
those things, you know.
Even the Family Dollar,
That's what I was talking
Oh,
about.
that one?
Yeah.
Oh my God.
Yeah.
And I was talking about Mayor May fighting
Oh,
this
okay,
election.
yeah.
It was like,
That's-
come on, Steve.
Yes, Richard.
So, full transparency here.
Please.
And I alluded to this some, I still don't believe it yet.
Okay.
What I'm seeing, and I'm not calling anybody a liar or anything.
But as in it
I'm
won't
just
work,
saying the
probably.
numbers are incredible
Huh.
that I see here, and so for, your question was, what
Yeah.
would it take for you to support it?
Yeah.
I think.
Yeah.
And so for me, it would take a deeper dive into
Okay. Okay.
the research on it, because if it's true,
Yeah.
we wouldn't support it.
I know, this is so,
At least
yeah.
on the surface.
Like the
If-
U.S. has known about these for 30 years. They've been functioning in other countries for 30 years now. Swiss, you mentioned, was the first one. Why not here? So something is blocking this, right? It's not what people want here, or is it, is
Well,
it that they don't have
I said
information?
it earlier, I've been to these other
Yeah.
countries,
Yeah.
and they have plenty of drug use still, and with all of this, so,
Okay.
you
I
know,
mean,
that's.
they had wagons just for needles that go around at night in one country. And, you just walked up, got the needles.
What is it
Clean
about that
needles.
that's hard? What is it that we don't like about that?
Well, I didn't, at the time, I didn't like it. It's been several years ago.
Yeah.
It just seemed like it would help promote more of it to me,
Okay,
my thinking.
okay.
But I'm beginning to have a whole change in my thinking. But most of it seems like it's about the needles and the. It's
And
not
the
really.
death too, the OD. It's also.
Yeah, yeah,
Someone
yeah.
watching over you,
Yeah.
checking
Yeah.
on you.
That's true.
The needles, okay, that's coming up. Yeah, Jenny, did you?
I just had a couple of comments and thoughts. One of the reasons why I think it's never come to America is because people make so much money off of treating addicts like criminals and private prisons, counting each of those heads for a dollar amount, and politicians getting their cut of that. I think that that's a major reason why things happen the way they do. And then the whole dehumanizing part, we're not in it to invest money in these people because we're not like them, and why should we care about that when we should put our money into something else? So they're always at the bottom of the list, which is terrible, because people don't ever stop to think what the root cause is. What happened that got them to that point? What can we look at to fix, to try to get them back to where they were before they got to that point? People just don't want to put money into that because it's not profit making. That's the reality.
I saw your hand, Lucia.
But if you market it like you're bringing in jobs to the community, I mean, is
Okay.
that so bad?
That's interesting.
So
Like we're a small community, our economy is really not that good. If we're bringing in an establishment that could serve as a means to better people that are struggling and also provide jobs for those with medical specialties, psychology
Yeah.
specialties,
Yeah.
stuff like that, it's beneficial.
Okay, okay. I saw Lucia's hand.
Well, I think your comment was very, very good, and sadly, I think it's true. Nobody's perfect, and my experience with the people that I've known and myself, there are deeper issues. People feel hopeless, they feel unloved, they feel unwanted. I'm sure they get that feedback probably from, the community, et cetera, et cetera. But like I said, nobody's perfect, and they need to be encouraged, and they need to know there's hope, and they need to know there's help. And the only way I've ever seen that is through a faith-based organization. And like I said, we understand that there's nobody perfect. A lot of us, myself included, have been there before. And the only way we were brought out, so to speak, was through encouragement and knowing that there's hope. I really like what this man said about some kind of exchange, because that, to me, that would be the only way I could even think about it, really, is because that shows some kind of desire on that person's part to move forward and to heal and to have some type of responsibility, which I think is very encouraging for someone in that situation, because they don't really have it's probably a very general thing for me to say, but probably a lot of them don't have responsibilities, and that's a really good self-esteem thing to have, is to know that you have a responsibility and someone's counting on you, and that you know, they're expecting you to be there, and blah, blah, blah. And it also shows your desire to participate. So,
And I don't think it even needs to be huge. You know, it
Right,
could start
it doesn't
off
have to
really
be huge.
small.
yeah.
I know a
Anything.
family member who struggled with mental illness is doing so well because of a job,
Yes,
you know, and so some kind of self-worth.
yes.
So
that
how
they
is
can
this different
feel.
than like Job Corps or, you know, Sylvia would help me maybe with, you know, get people back to work programs, Act of TANF, things like that. How would this be a little different than that? Yeah, Chris?
To me, it's starting slower. I mean, you're not just saying, come here, we'll train you for a job and get you in the workforce. It's
Okay.
like, come here, you know,
Stay alive.
use
This little
wait,
job.
yeah, well, no, just
Or-
use, you know, like right now, that's where you're at, but you're using with some people and we're talking to you and maybe we're planting some seeds, and it's just, to me, it's just starting over here instead of over here.
And I'm not saying this would work, but it could be as easy as saying, when are you coming again? Okay, I expect to see you at that time.
Right.
You know, it could be something
Just
that easy, because you have to start easy, you have to
bond to
start.
somebody there and you're like, well, I
Otherwise,
want to
you're
go
setting
visit.
too many high goals that these people
Yeah,
can't.
and then they fail.
Exactly.
And then they feel even worse
Exactly.
about themselves. Yeah.
But Jennifer, there's
Yeah.
a program here in Silver City that they pay the clients $25 to come to their group. And
Wow.
it's a substance abuse group.
Wow.
And that's not working very well either.
Yeah.
Interesting. Let me just check in with Kyle real quick a question. You remember we talked the other day about maybe at the end after you discuss kind of a question. Sammy, thank you. Yeah,
Thank you.
You betcha.
But you guys take care of
Just
yourself.
let me know and I might open it up and kind of reveal.
I talk about
No,
that.
we're gonna do- I know a lot of
Not quite yet. Let me just think. Okay, well, I think we're about done. I mean, I feel like you guys have said a lot.
I've heard a lot about it.
Yeah, me too.
Let me just is there a burning desire, as they say at the end of the meetings, something you just didn't get to say that you'd really like to? And especially for us, we're like going to be listening for, if this could work, why? You know, what would the community need? What would they want if they wanted this to work? Is there something missing?
Obviously, it's working somewhere.
Yes. it is.
Okay, so it's like, that needs to be studied, and we, you know, you need to know where it's working, because you gotta know what the environment and, you know, politics, et cetera,
Okay.
going on there and compare it to this country.
Well, let me just play devil's advocate for a second then.
Okay,
The working is, they save lives in the
Right.
many thousands, and we are not saving those lives
Right.
here. They are dying left and right. So is that enough for you guys?
yes,
Just save lives, and that this is a major way to do that?
Yeah,
Or
yeah,
is it still like, oh, there's something in bad taste in my mouth, I don't like it?
that's enough for me.
I think it's
Yeah,
enough for
that's
me, but I think cultivating a life worth living, you know, saving a life is good, having a life that like you want to
Quality
live
life.
further is also important. And they're halves of the same point, but
You gotta save it in order
I
to
think,
get
I
it
think
going.
we have people sitting at this table that are in recovery, okay, that have that hopeless state of mind, that today can look at it and say, yes, it was worth, whatever it took me to get here, it was worth it.
I'm glad I didn't die.
Okay,
Yeah.
I'm glad it, thank God, only by the grace of God, okay? But it's the type of scenario that if you try it and only save one life, then it was worth it.
Interesting, yeah.
You know, because we spent a lot of money on the war on drugs, right? I mean, we spent a lot of money, okay? So I think that trying, because I do believe in the disease concept. I started my statement by that, I'll end it by that. So being a disease concept, we spent a lot of money trying to cure cancer. We spent a lot of money doing a lot of things. So I think if you have the additional funds, then it should be tried. I'm not, like I say, but once again, I go back to the staffing issue. So I think that in a community of this
Right, and
size,
cost, which you can say, I will, since we're wrapping up, I can say these are usually very, very cheap. maybe 1/100th the cost of typical rehab can be, because you can staff it with paraprofessionals, that kind of thing. But okay, well, this is what I want you to do. The last thing is actually, if you would take your 3 packets out, I want you to put a big black check mark on the front of the one that you liked the best, or the one that you were the most favorable of, okay? And then put it back in your package. Just one big black check mark on the one you felt most favorable of.
This is what I do.
Do we do your, hey?
You can take the
No,
pen if
I-
you want.
Another
So,
I've already stolen one.
it's your one page.
one. 2 counts.
I know, it's sort of color now, but when it first started, it was, yeah.
There is a restaurant
Wrote it vanilla.
Yeah.
Yeah, I just learned that last year.
Alright, let me just send us out. So, this is a debrief.
I had an
No, I don't, but I just.
Yeah.
30 seconds.
So,
Okay, fine, then.
ladies and gentlemen, we are finished. This